I'm Sabrina Carver, and I'm going to be doing my health assessment video. My patient today will be Tamara, and so she's going to help me out with that. Before I begin, I just want to let you know I'll be using a few props. This butter knife plastic utensil will be double as my tongue depressor, as well as my otoscope and my sensation tool. I also have a blood pressure cuff here that is actually not working, so it will be a prop, but I will say what I'm doing as I do that. So before I go into the room, I'm going to wash my hands and go in and start my head to toe physical examination on her. Okay. Knocking before I go in. Hi Tammy, my name's Sabrina.
Hi.
How are you today?
Good.
Good. I hear you're, what brings you in today?
Just to meet you and have my first physical exam, because I don't even think I've had one before.
Perfect. Okay. Just a couple things before we get started. I wanted to ask you a little bit about your medical history. Any significant history, cancers, diabetes in your background?
My aunt had breast cancer, but
Okay.
my father had heart disease.
Okay.
Otherwise, not really
Okay.
anything significant.
Okay. And I see that you do not have any medications that you take, is that correct?
Correct.
And no over-the-counter vitamins, anything?
Nope. I'll just use ibuprofen for pain if I need to, not frequently, and otherwise I don't take any pills.
Okay, great. And have you gotten your flu shot yet this year?
Yes, I just got it last week.
Very good. Okay. Do you know your current weight?
Yes, I'm 165 pounds.
Okay. Okay. And your height?
5'5".
Perfect. Are you having any pain today?
No pain.
No pain. Okay. I'm going to be making a little notes while we go go from here. And if you have any questions in the middle, go ahead and stop me and feel free to ask. Okay. All right. So I'm going to start by taking your vital signs. Okay. So I'm going to just start with your blood pressure here. Okay, I hear about 172, sorry, not 172, 122 over 70. Does that sound about right?
No, it's pretty normal.
Okay, let me just write that. 70, great. Get that off, yeah?
Is that a good blood pressure you said?
Yeah, it is actually good. 170 would not be, but yes.
Oh, good.
Yeah, 100, sorry to confuse you.
That's okay. All right, let me just.
Your pulse here. It's nice and even. I'm actually gonna feel for 30 seconds today. I'm actually just watch your respirations too. So your respirations are about 16. Which is again very good. And your pulse is at 74 today. Okay? Okay. So while I'm looking, doing your head to toe assessment, I'm going to be looking at your skin. I'm going to be looking at if it's moist, warm, dry, all of those things. Okay?
Okay.
All right. So let's start with looking at your head here. Okay? I'm just checking to see if you have any nodules or any abnormal bumps. Red marks, I see nothing there, which is great. Let me go ahead and check your cranial nerve 7 here. Can you smile for me? Very good. And I'm going to also check your temporal artery and your frontal sinuses. Any pain or pressure in there?
No.
How about your maxillary here?
No.
No? Okay, great. And let me just go ahead and look in your ears, okay? Get my little otoscope out here. Alright, they look look good. Any pain with your ears?
No.
No? Okay, I'm gonna check the other side here. Okay, very good. Pull up and back. Let me just make a couple notes here. Okay.
Because what's normal in there? Do you see like?
What we want to see, some clear pathways there. You don't really want any real redness or inflammation in there. You want them to be pearly gray and pearly light gray looking color. Okay, so I'm going to go ahead and take a peek at your eyes. I'm going to have you just look at the light here. Okay, and I'm going to actually check your cranial nerves 3, 5, and 6. Are you following the light here, please? Okay, very good. Now I'm gonna actually have you, I'm gonna check your pupil reaction. Okay. Very good. All right, let me do the same thing here. Okay, looks like your pupils are equal round and to the light, so that's really good. Okay. Let me just take a little peek at your conjunctiva. Any eye pain at all?
Nope.
Okay. They look like the color they should be. Your irises, from what I can tell, look like they're good as well. Good. Okay. So let me go ahead and take a peek in your nose. Okay. I'm going to use my little tool here, little otoscope here. All right, nostrils are patent, nice and pink. Do you have any discharge ever? No? Okay. And now I'm going to get my, take a peek also at your throat and your mouth. So if you want to go ahead and open your mouth for me. Okay, your tonsils look good. Go ahead and say ah, stick your tongue out. All right, great. Your uvula with your cranial nerve 9 and 10 looks like they're doing what they should do and keeping that right midline.
Okay. It's like interesting.
Isn't it?
Yeah.
Can you stick your tongue out for me? Great. Okay, that looks like it comes straight out the right way it should be, and that would be your cranial nerve number 12. Cranial nerves are pretty interesting.
Mm-hmm.
All right, I'm going to put some gloves on here and check inside of your mouth. Can you go ahead and open for me? I'm just checking your soft and hard palate. I don't feel any nodules. Go ahead and lift your tongue. You can check underneath. Great. Okay. Do you have any problems with your swallow?
No.
No? Okay. I'm going to actually have you take a little drink of this water here I have. And as you do that, I'm going to watch your trachea. Great. Which looks like it's nice and midline. I'm just going to feel here. Okay. Okay. Very good. I also want to go back and check for TMJ here. Do you go ahead and open and close your mouth here? Great. One more time. Okay, I do feel a little bit of TMJ there. Do you wear anything at night for that?
Yeah, I actually have a mouth guard for it.
Okay, let me take a little note there. Make sure I document that. All right, and I'm going to look here at your cervical nodes. Everything feels good. Very good. Okay, can I have you go ahead and push against my hand? Great. And this way too? Good. Okay, and go ahead and just turn your head to the left and back to the right. Can you move your chin to your chest here? Good. Okay. And back just a little bit. Perfect. Any pain with that?
No.
Okay. And I didn't feel any swelling. It looks like your thyroid is nice and the way it should be, so that's good. Okay, so I'm actually going to have you lay down here. Actually, before I do that, let's actually take a listen to the back of your lungs,
Oh,
okay? Sorry about that. I keep having to move back and forth.
That's okay.
Okay.
Sorry, my hair's pretty.
It's okay. Go ahead and take a deep breath for me. Good. And one more time. Okay, great. Can you repeat 99 for me?
99,
Again?
99,
And again?
99.
Okay, no practice, that's good. And do you have any pain when I palpate here?
No.
I'm sorry, when I percuss here?
No.
Okay, all right. Your skin looks good, looks intact. I don't see any lesions of any sort, so that's good. And no pain in your, down your spinal cord? Okay, looks really nice and straight. Okay, I'm gonna go ahead and actually take one more look here. Your jugulars actually look like they're not distended, so that's good as well.
Good.
Okay? Alrighty. I think I'm gonna have you go ahead and lay down, and I will take a peek at your, just kind of do the front of you, I guess, huh?
Okay.
Okay. Alright, so I'm just gonna do some little inspecting and kind of feeling around, okay? Some palpating and inspecting. Any pain in here?
No.
Okay, can you say that 99 again for me?
99,
Very good.
99.
Okay, good. Okay. And let me just peek at your tummy here. Alright, great. I'm gonna take a listen to your lungs, and then I'll listen to your belly as well, okay? Okay, go ahead and take a deep breath for me. Good. And again. Great, okay. I'm gonna go ahead and listen to your heart while you're here. I'm gonna start with your apical pulse. I'm listening for a full minute. Feels nice and regular. Move on to your tricuspid. Good, and your mitral now. Great, very good. All right, before I start listening to your oscillating your stomach again, I just want to peek here. Any pain with your bowels?
No.
Are your bowels regular?
Yes.
Okay, and when was your last bowel movement?
This morning.
Great, okay. We'll go ahead and listen to your all four quadrants of your abdomen. Very good. You have normal tones. And all three quadrants, very good. I'm gonna do a little percussion here. I'm sorry, some palpation here. I'm gonna do a little soft. Any pain with that?
No.
All right, I'm gonna do a little bit deeper here too. Any pain there? Okay. I'm gonna go ahead and feel your spleen, see if I can feel it, which we don't want to feel it, which is good. And your liver over here as well. Any pain when I push there?
No.
Okay, very good. I'm just gonna go ahead and look, feel your femoral pulses here, or your inguinal pulses. Sorry about that. Okay, nice and even. Okay, great. All right. So let me just take a look down here at your feet. I'm gonna pull your pants up just a little bit here. Nice hair on your legs. That's actually a good thing. If you know that, kind of shows that you have good circulation down. Any numbness or tingling in your toes?
No.
All right. I'm gonna check your cap refill. That looks really good. Can you go ahead and pull your feet towards me? Okay, great. And then push against like you're pushing on the gas. Very good. Okay, let me check your pulse here. Nice and even. And your pedal pulses. Very good. I'm gonna make a couple notes here.
Okay.
Let me just double check.
Is it okay if I pull my pants, my legs down?
You can. I'm sorry about that.
That's okay.
Go ahead and.
I just figured I'd help you out.
Well, thank you for that. I do want to check your hip. Go ahead and push against my hand out. Very good. And now can you pull in? Very good here. Any pain in your hips?
No.
Okay. And then this way? Okay. Very good. All right. You can go ahead and sit back up now.
Okay.
I'm going to make a couple notes while we're right here. Thank you for your patience. I appreciate that. Okay. Okay. And I'm going to have you actually, I'm going to have you close your eyes for me. And I'm going to just kind of tell me if you can feel when I touch.
Okay.
Yes.
Yes. Yes. Yes. Yes.
Okay.
Yes.
I probably should have started at your face so that I didn't wipe your feet on your face. I apologize for that.
That's okay.
Okay. Keep your eyes
Oh,
closed for me,
sorry.
please.
Yes.
That's okay. You can feel that.
Yes.
And how about over here?
Yes.
Okay. And you said you had no numbness or tingling in your hands or feet.
Correct.
Okay. Before you open your eyes, could you go ahead and hold your hands out for me? Turn them over. I'm going to place an item and close your eyes, please.
Oh, I'm sorry.
That's okay. That's okay. I'm going to place an item in your hand, and I'd like you to see if you can describe that for me.
Okay.
Okay, go ahead.
A squishy ball.
That's right. Okay. Now, how about this one here?
Soft. A pink eraser.
Yeah, you can tell color by that. That's great. Thank you. All right, that
It's a
sounds.
brand actually, but that's okay. They're just softer than
Yeah, that's true. You can open your eyes now. Okay. Okay, very good. All right, so can I have you go ahead and stand up here, please? And I want to have you hold your hands out for me and close your eyes. Okay, very good. Now I'm going to have you go ahead and bend forward a little bit. I'm going to check your spine. And can you touch your toes? Nice. I don't see any abnormal curvature or anything here. That looks really good. Now let's go ahead and do some shallow knee bends. Can you do that for me?
like that.
Yep, just like that. And how about the other side? Very good. Nice work. Okay, now the next thing I want to have you do is go ahead and walk heel to toe across just a couple feet forward. Very nice. Go ahead and turn around and do that and come back to me. Very good. All right, you can go ahead and have a seat again. Okay, so let me go ahead and check your patellar reflexes. Okay, just let your leg dangle here. Ooh, very nice. That's a good one. All right. Okay, good, good. I'm gonna go ahead and check your in here too, and let that. Okay. Okay, very good. Alrighty. That looks really good. Let's see here. I am going to have you. Actually, I was wondering if you had any questions for me.
I don't think so.
Okay, let me peek through my notes just to make sure I am
I'll
kind of
think about it.
somewhat new at this, so I want to make sure that I've gotten everything here. Everything so far looks really good to me. I don't really see anything that looks abnormal, which is great. Okay, do this last
I've
little.
had some pain in my heel. I
Oh.
don't know if you're able to take a peek at it.
Yeah, absolutely. I kind of looked at your toes, but definitely let's go ahead and take a peek at that. That is actually really important. So why don't you go ahead and lay back down, and I'll take a peek at you.
I'm sorry I told you I didn't have pain earlier, but I forgot about it.
Okay.
Because it's kind of in my arch of my heel there.
Okay.
Weird.
Okay. Can you go ahead and take your heel and place it or slide it against the opposite shin? Is it just that one?
Yeah.
Okay.
And
how
it's
about the
not
other side?
all the time. It's just sometimes.
Okay. All right. That's definitely something that we'll tell the doctor about.
Okay.
Okay. It looks like the range of motion and everything else, your strength is good in your heels. Can you bend your knee up for me? Yeah, everything else looks good. We'll definitely let the doctor know that, okay? All right. Well, if you don't have any other further questions for me, I think this would conclude my portion of the assessment. Okay? All right. Thank you.
Thank you very much.
You're very welcome.